How do I decide where to give birth? Have you and your birth partner thought about where you would like to give birth? These decisions are best made before you go into labour, but you can always change your mind. Your midwife or doctor will make recommendations of the safest place for the birth and may recommend a change to the birthplace if something changes in pregnancy or during labour. Depending where you live, there are different options available: home birth, a birth centre led by midwives, or in the maternity unit within a hospital. Home birth. At home, you will be in a familiar place and can create your own birth environment. If you'd like to use a birth pool, you can hire one and have it filled ready to go. The midwife will bring most of the equipment and care for you during the birth. If you've had an uncomplicated vaginal birth before, a planned home birth is as safe as having your baby in hospital or birthing centre. Birthing centres, sometimes called midwife-led units. These can be part of the hospital or separate in their own standalone unit. You will be cared for by midwives and support workers and can use a birth pool if you'd like to. They can give you a great home-away-from-home experience. With these birth settings, you don't have access to doctors or some forms of pain relief. If there are any concerns during the labour, the midwife will recommend and support you to either transfer to hospital or move to the area of the hospital with access to the care you need. Both home birth and birthing centres are usually recommended if you have a straightforward, uncomplicated pregnancy and you and your baby are well. Statistics show that planning birth at home or in a birthing centre for low-risk pregnancies reduces the chance of birth interventions, such as birth with forceps. Obstetric-led unit, sometimes called labour ward or delivery suite. These are always located within a hospital. Here you will be looked after by midwives, but anaesthetic, obstetric and neonatal doctors will be available to care for you and your baby, which may be recommended if your pregnancy is more complicated. You can also choose to give birth here if you want to. Questions to help you decide. Can I tour the maternity facilities? What equipment is available, e.g. birthing pools, floor mats, balls or bean bags? What pain relief is available? How many birthing partners can I have? Where will my baby go if they are sick or premature? How long would it take if I needed to be transferred to hospital? Which hospital would I be transferred to? Talking through your options with your midwife can help you decide. Wherever you choose to give birth, it should feel right for you.